Formed of three types of bone. We have the carpal bone, metacarpal bone, and the phalanges. And the phalanges, we have the proximal, intermediate, and distal row. Except for the first phalanx, we'll be having only the proximal and distal. Okay. And for the carpal bone, so the identification is important. So you need to put it in the anatomical position. Anatomical position will be like this. The palm of the hand will be facing anteriorly. Okay, and then we have two rows. We have the proximal row and the distal row. When you start from the lateral side. Okay, so there are so many mnemonics you can use. Okay, I think the last one was she's too pretty to catch her, something. Okay, so we have first the scaphoid. Okay, scaphoid bone. Then we have leonate, and then we have the triquetrum and the pisiform. And for the pisiform, basically, I think it's not here. It's supposed to be in this area. And then we have the trapezium, trapezoid, capitate, hamate. How to know hamate? From this hook, called the hook of hamate. This one, called the hook of hamate. So scaphoid, leonate, triquetrum, pisiform. Trapezium, trapezoid, capitate, hamate. Capitate, hamate. The clinical, the type of this bone, they are short bone. Okay, and one of them will be sesamoid, which will be pisiform. What is the meaning of sesamoid?
Bone found within a tendon.
Yeah, bone which develops within the tendon. What tendon? Flexor carpi and nares tendon. This will be the questions asked. What type of the pisiform? What do you mean by sesamoid? What is the name of the tendon which developed within? And then for the metacarpal bone, those will be long bone. They are not short bone. They have upper two ends and shaft. Okay. The most important to know where is the base and where is the head. Okay. The base will be the proximal. BB. The base is proximal, and then there will be the head will be distal, and then we have the shaft. Okay. And then we have the phalanx, as you mentioned before. The critical importance would be the fracture scaphoid, very common. How to know that there is a fracture of the scaphoid? There will be swelling of the anatomical snuff box. Swelling and tenderness here, anatomical snuff box, which means a scaphoid. Why scaphoid is very dangerous to fracture? Because there are certain complications as the malunion or delayed union or avascular necrosis, because the nutrient artery of the scaphoid very fragile, easy to get injured during the fracture, so the bone cannot heal again. Okay, so this is the important part about the If you look at the carpal bone here, yeah, you can see that the bone is concave a little bit. So this one share in the formation of the tunnel. And then we have the roof of the tunnel. The roof of the tunnel will be formed by the flexor tuniculum. Okay? And then we have the tunnel, we have 10 structures which will be passing through. Okay? We have the tendons of the flexor digitorum. So now we have mentioned 8 structures. Okay? So 4 and 4. Because those muscles will be inserted into the bones by 4 tendons, flexor digitorum superficialis and flexor digitorum profungus. And we have one nerve, which will be the median nerve, which will be passing through the tunnel. Okay? And another tendon, which will be the flexor pollicis longus, right? Flexor pollicis longus. Okay? Okay. There is a compartment here within the tunnel, but it doesn't consider it as a part of the. Yes. This one contains a tendon, flexor carpi radialis longus. Okay. So you can see here that all those tendons will be surrounded by flexor sheaths. Okay. Sometimes when there is infection in the surrounding sheath, it may affect the median nerve. So this one will be very common site for median nerve injury. So there will be tingling and numbness in the sensation of the medial, of the lateral tutor, medial tutor.
Lateral. Actually, actually, it will affect your thinner muscles.
Thinner muscle.
The sensation over the thinner won't be affected because you have a superficial
Superficial one which come
coming
over.
over. But
So the lateral tutor, sensation from the lateral tutor to the palm of the hand will be affected. Okay. So this one always very common in occupational, some occupational injury as the divers, the one who's divers, which use the tendons a lot. So here tend to get in contact with the medial nerve, which will lead to irritation. This one causes the problem. Also, one of the causes would be the pregnant woman, because in case of the pregnancy, there will be edema. So edema also will be surrounding the fluid will be surrounding the sheaths and all those tendons, which will make the space very tight, compress also the median nerve. Okay, so all those are common side for carpal tunnel syndrome plus infection also. Okay.